Population Health Management, the Quintuple Aim. Dr. KJ Young from Healthcare Repair with you again to discuss population health management. Let's take the next 3 minutes or so and let's discuss the Quintuple Aim. So the Quintuple Aim is a new method of addressing how management can better achieve population health management strength in the community. So initially we always followed the triple aim, and that was patient care, population health management improvement, and then cost reduction. And those three really helped carve a path for us historically. But then we added a new dimension from the balanced scorecard aspect of management, and that was work-life balance for your own employees. A pretty big dynamic that allows the employee to help own in the patient care, and then if one is happy, the other should be happy. Just very recently, the addition of equity has been pulled in, whereas typically equity was part of the patient care and part of the cost reduction. Now we carve it out on its own, and this is very much a shift from volume to value in healthcare. We tend to try to put the patient experience first in our metrics because in your own life, you tend to return to grocery stores that treat you very well. You tend to give repeat business to those that have your best interest at heart. So the patient experience is very much right in line with that. In essence, what we want to try to do is meet the preferences of those individuals. So this involves providing patient-centered care, coordinated and integrated care. Mainly, I want to follow up here that fostering trust is the biggest, most important dynamic. Improving the overall population health is our real goal here. Mainly, what we try to strive for proactively is addressing the social determinants of health. And we've listed a few here: income, education, environment, lifestyle. Certainly there are dozens more that we are continuing to uncover. And that really folds back into equity that we will follow up on later. But implementing preventative and wellness interventions to reduce the risk and burden of chronic disease is the real trick here, isn't it? Because hospitals are brick and mortar that tend to cater to acute care. And if we're keeping patients out of the hospital, then all that brick and mortar tends to go to waste. So there's a true dichotomy of thinking that how should a healthcare institution fund to better steer these social determinants of health? It's a double-edged sword for many CFOs. And speaking of CFOs, reducing overall cost is critical. So here we've listed that this involves identifying and eliminating inefficiencies, waste, and duplication in healthcare. So we've been working on that for 20-something years, and many of the innovations that we have come from supply chain innovation. New technologies are sort of on the invention side, and they can be expensive upfront. So patient cost can tend to go up as technology improves. But as throughput continues, that's when our prices tend to drop through volume. Next point, strategically optimizing the use of resources and technology to achieve better outcomes at lower cost can also be stretched to say by reducing labor. And that's not always the best thing. Sometimes it's best to right size your labor by license. You want to exercise everybody at their highest expression of license without wasting their time or wasting your money. So probably my favorite new aspect of population healthcare is improving work life, because you can really see this on the eyes of your employees, your case managers, your outreach team, those in the field, those that are reporting back to you that just have a dotted line. If you are the leader, and leadership must create a positive and collaborative work environment that reduces burnout, turnover, and errors. Just imagine all the registered nurse gaps and troughs that we've had in hiring in the past, and how if you could improve that burnout point, and that goes as far as EMTs, nurses, the the cooks and the environmental services in your very hospitals. So this involves supporting the physical, mental, and emotional health of healthcare providers and staff. This is a really big deal in the age of post-COVID, where so much is done by video, such as this, or outreach, where you don't really have a shoulder-to-shoulder, a handshake, or an opportunity to sit down and look somebody in the eye. It's important that leaders be very sensitive to this. The study of social determinants of health has really helped uncover the issues with health equity out in the real world. So you'll find areas where there are food deserts or zip codes where nobody graduates high school, or entire counties where their gross domestic product is dependent upon production of illicit substances. In this case, those are all worst case scenarios, but that's very real for us to deal with. Asking somebody to log into their portal so that they can get their prescription or their next appointment may not be tenable if nobody has a computer, or if there's some places that have zero Wi-Fi or zero internet at all. So here we've stated meticulously addressing the disparities and inequities in health outcomes and access to care are critical. Stratifying populations to include people based on their race, ethnicity, gender, age, disability, and other factors seems like a no-brainer, but a lot of our bias in healthcare tends to come from algorithms that are just written to the majority. And the majority tends to be where we would have our cost savings, where we would have our lowest threshold of barrier to entry, etc. But it tends to leave out all of those that we've already addressed here. So this has been a very quick overview of the quintuple aim, and population health is always very dynamic, always evolving. From here at Healthcare Repairs, Dr. KJ Young at your service. I appreciate you joining today, and reach out to me if you have any questions or if you would like to learn more about any of these subjects. Thank you very much.